Hello, I'm Hina Song from Nexus Korea. Over the past 2 years, Korea has attracted global attention as the media revealed how the Korean government and people were coping with the COVID-19 viruses. Korean public healthcare is undoubtedly the world's best. Today, I talk about subscription to Korea's National Health Insurance Service or NHIS, insurance premiums and medical costs, support for disease prevention, the hospital system, and finally, whether foreigners can subscribe to Korea's National Health Insurance Service. In Korea, it's compulsory for all citizens to subscribe to the National Health Insurance Service, which is operated by the government. People pay their insurance premiums based on income and wealth. And when they are sick, they can get high-quality medical treatment and prescription drugs at an affordable cost. There are two kinds of subscribers, the employed and the others. If you are working at the insured company, you pay just 50% of your insurance premiums and your employer the other 50%. If not, you pay all the insurance premiums. These two categories have different standards and ratios applied to the calculation of insurance premiums, so it's difficult to say which one is more advantageous from a point of your out-of-pocket expenses. The government has revised the relevant regulations several times to ensure a fair premium calculation. Now let's talk about insurance premiums and medical costs. Let's say you're employed, your annual income is less than $30,000 and you have no or little wealth. In that case, you may pay about $100 every month for your health insurance. However, as your income and wealth increase, your insurance premiums significantly go up. If you're a middle-aged office worker from middle-income families, your monthly insurance premiums can be around $400 to $1,000 in usual cases. If you're a high-income earner and own big wealth, your monthly insurance premiums may go up to about $3,000. Now I'll tell you about some examples of medical costs. If you receive a prescription for digestive or cold medicine from a small hospital in your neighborhood, your out-of-pocket expense will amount to about $10. Let's say you give a birth to a child through cesarean section. It may vary depending on your situation, but it usually costs around $1,000. If you have a big surgery or a serious disease treatment, the medical bill may be higher than usual. Those who have deep concerns about health problems may purchase additional personal insurance. The Korean government pays attention to the disease prevention as much as the disease treatment. If you're aged 20 through 64, you get free basic medical checkup every 2 years. If you have young children under 6, you don't have to pay for their medical checkup and vaccination. If you're middle-aged, you will get free basic cancer examination. School children can get free dentist checkup. If you decide to quit smoking and visit the local clinic center, you can get free government support. The elderly pay no money for vaccination. There are more public health promotion programs in various ways. If you have a serious disease like cancer, which requires long-term treatment and high medical costs, the NHIS gives you additional support. For the elderly who need long-term care in their daily life, the NHIS also provides special support. In case of Class 1 infectious diseases like COVID-19, the government provides every citizen with all medical costs and support. All of Korean hospitals are categorized into three. Class 1, small hospitals in your neighborhood. Class 2, middle-sized hospitals in your local cities. And Class 3, large general or university hospitals. When you feel bad and sick, you first go to a Class 1 or 2 hospital. If you cannot receive necessary medical services there due to the lack of professional personnel or necessary medical equipment, the doctor will give you a medical referral letter. Then you can move to a Class 3 hospital. If you directly go to a Class 3 hospital without doctor's referral letter, your medical bill will not be covered by the insurance. You have to pay all by yourself. Can foreigners subscribe to the National Health Insurance Service? Yes, they can, as long as they meet the requirement for a resident. Foreigners residing in Korea and working at the insured company are compulsorily subscribed, and those who have stayed in Korea for more than 6 months are also subject to mandatory subscription to health insurance, so your visa type is important in this regard. The National Health Insurance for Foreigners has the same coverage as it does for the Korean citizens: disease prevention, diagnosis, treatment, or rehabilitation for the insured and their dependents. This is all for today. Thank you for watching this video. I'll see you next time. Bye.